Let's go over natural ingredients to grow hair in androgenic alopecia. Based on this literature review, I'll let you know which of these ingredients I'll plan to put into our hair products that we are in the process of formulating now. And you'll be able to understand for the first time why these components are beneficial potentially for helping with hair restoration. We will proceed through these ingredients in an alphabetical order. The first is azelaic acid. This is something that comes from a fungus, and it's derived from grains such as wheat and barley. The mechanism of action of azelaic acid is that it induces contact dermatitis, and it's anti-androgenic by blocking 5-alpha reductase. There's only been one study that was performed for alopecia areata, which is actually the condition that I have, and not androgenic alopecia, and this was not a placebo-controlled study. The next natural ingredient is biotin. This is also called B7, and it serves as an essential cofactor in multiple metabolic pathways. Biotin's main function is protein synthesis, and more specifically in keratin production, explains its contribution to healthy nails and to healthy hair growth. Biotin is actually normally found in many of the foods that we eat, and it's also produced by normal gut flora. In patients who are deficient in biotin, which is actually a small percentage of people, supplementation seems to help with hair regrowth. However, there's been no randomized study that has looked at proving the efficacy of supplementing with biotin in normal healthy individuals. The next natural ingredient is caffeine, as you guys know all too well. Caffeine stimulates hair growth in male and in female human hair follicles in vitro. That's been shown. There was one recent study in 2022 that actually took hair follicles from balding vertex area scalp biopsies of men who were affected by androgenic alopecia and incubated them with corticotropin releasing hormone, which is called CRH, plus or minus caffeine. And what they found was that caffeine was actually able to counteract the hypothalamic pituitary adrenal stress axis. That's the HPA stress axis. And it also counteracted the non-HPA neurogenic stress axis. So caffeine might actually counteract stress-induced hair damage and possibly prevent stress-induced hair loss. The next one is curcumin. This is an anti-inflammatory and immunomodulating agent that has been shown to inhibit NF-kappa B and to decrease TNF, which is tumor necrosis factor, and interleukin. These are all inflammatory cytokines that are associated with hair loss. So curcumin actually downregulates these different cytokines. Also, curcumin has previously been shown to actually inhibit androgen receptor expression, and that is what we know is involved with the miniaturization of hair. Next, let's talk about garlic. Garlic derives from a medicinal plant that has been used for centuries, and the mechanism of action of garlic is that it increases blood circulation in the scalp. So there was one double-blinded placebo-controlled study that showed an increase in capillary skin perfusion by 55%. And this study was performed in 1991. It was called The Influence of Garlic Powder on Cutaneous Microcirculation. Old study, but an interesting one nonetheless. Another that was more recent in 2007 using garlic gel that significantly added to the therapeutic efficacy of topical biomethasone, which is a steroid, in alopecia areata. So some people use that study to justify the use of garlic for androgenic alopecia, but I think that's a big leap to make. Next is green tea. Green tea is anti-inflammatory and anti-carcinogenic, and that has been reported in several different studies. The effectiveness of green tea extracts was demonstrated on hair loss in mice in a 2005 study. There were two groups. One received green tea extracts in their drinking water, and the other group received only regular drinking water. 33% of the mice in the tea extract group developed hair regrowth within a 6-month period. However, in this study, they did not provide a percentage of mice in the control group who may have experienced hair growth as well. So I think there were a lot of deficiencies in that study in particular. Plus, it was only done on mice. Next is olive oil. And there was a case series that showed improvement when used for psoriatic alopecia, not necessarily androgenic alopecia. And there have been no known controlled trials confirming the efficacy of olive oil in treating hair loss. The next ingredient is pumpkin seed oil, or PSO. This one's interesting. So this has beneficial nutrients such as essential fatty acids, beta-carotens, lutein, tocopherols, and phytosterols. That's a mouthful. It blocks 5-alpha reductase and has anti-androgenic effects in BPH, which is benign prostatic hyperplasia. In one randomized double-blind placebo-controlled trial of 75 men with androgenic alopecia, patients received 400 milligrams of PSO per day or a placebo for a total of 24 weeks. At 12 and 24 weeks, there were 30% and 40% mean increases in hair counts from baseline in the PSO-treated men, and only 5 and 10% increases in hair count in the placebo-treated men. So in total, there were 25 and 30% net increases at weeks 12 and 24 in the intervention group compared with the placebo group, using phototrichography for comparison. So this was a promising study, in my opinion. The next one is rosemary oil, and this is something that we get asked about all the time. Rosemary oil comes from a medicinal plant that has been shown to enhance microcapillary perfusion. There has been one single blinded randomized controlled trial that compared rosemary oil to 2% minoxidil ointment, and the results were that they were equally as effective. Let's analyze this study together. This was a study that was published in 2015 in the journal Skin Med from Iran. The impact factor of this journal is 0.2. Keep that in mind, because the benchmark as far as like the most popular journal is Nature, and that has an impact factor of 43. SkinMed is 0.2. They excluded patients who had 5-alpha reductase inhibitors on board in the preceding 6 months. Patients were randomized to either getting rosemary oil, which were 50 patients who received that, or minoxidil 2% topical, and there were 50 patients who received that one. The patients applied 1 milliliter of a assigned solution twice a day to the scalp for 6 months. The primary outcome measures were microphotographic assessment, and they looked at hair counts, but they didn't exactly explain their technique for measuring hair counts. You can see in table 1 that there's a similar age between the two groups and a similar hair loss duration as well. The baseline hair count, however, was higher in the 2% minoxidil group, making it, in my opinion, harder to later show an improvement. So when you look at this graph, which is their primary result graph, you don't need to be a scientist, in my opinion, to see that not much has changed across the board in both groups. Take a look. Minoxidil 2% group, rosemary oil group. To me, when you look at the hair number or the hair count on the y-axis, and then the baseline month 3, month 6, the time scale on the x-axis, there really isn't much change. And if you look at those vertical lines that are coming off of the rectangular bars, those are the standard deviations, and that's a pretty big standard deviation per each group. So they concluded in this study that both groups experienced a significant increase in hair count at the month 6 endpoint compared with the baseline. And they said in the present study, the application of topical rosemary solution was as effective as minoxidil 2% in the treatment of androgenic alopecia. Now, I take some issue with that. First of all, the large standard deviation reflects a large amount of variation in the group that is being studied. So it looks like it's unlikely that there's a statistical significant difference looking at the main values, given the fact that there's such a large standard deviation. And the conclusion of as effective should really say equally ineffective, because neither group changed by much from the beginning of the study. This was one of the clinical outcome photos that they provided in the study. This was for the minoxidil group. Now, what is going on here? Can anyone tell? Very hard for me to tell. The zoom of this picture from A to B, from the before and after, is quite different. The way that the hair is styled, the lighting conditions, all of that is very different in this photo, making it very difficult to compare. But then the author said that minoxidil is as effective as rosemary oil, but they're not showing efficacy in their study. And this is misleading since we have many studies showing real minoxidil efficacy for hair growth. So it would have been better if they demonstrated those improved results with minoxidil, and then they showed that there was also an equal bump up in efficacy with rosemary oil. That would have been fine, but here the results were very flat across the board. The large standard deviation underscores the large variation in the hair counts. All right, next let's talk about saw palmetto. Saw palmetto is primarily comprised of fatty acids, phytosterols, such as beta-cytosterol, beta-carotene, vitamin E derivatives, and polysaccharides. Saw palmetto is a natural inhibitor of both type 1 and type 2 5-alpha reductase, which prevents the conversion, as you know, from testosterone to dihydrotestosterone. It's used as an alternative treatment for benign prostatic hyperplasia, or BPH, and that dates back to the 13th century in Egypt. Several human studies have demonstrated modest hair regrowth using oral and topical saw palmetto containing products among patients with androgenic alopecia. Improvement in total hair count ranged from 3.4% to 27%, increased hair density in up to 83.3% of patients, 60% improvement in overall hair quality, and stabilized disease progression among 52% of patients were noted with the use of various saw palmetto containing oral supplements, topical lotions, and oral serums. Next is tea tree oil. This comes from an Australian native plant. It's antimicrobial and anti-inflammatory in nature. A 32-week pilot study showed that a microemulsion composed of minoxidil, diclofenac, and tea tree oil was superior to minoxidil alone. 32 total patients, 10 to 11 patients per group. And the biggest issue that I had with this study was that the tea tree oil study arm also had diclofenac put into it, which was a big confounding factor since diclofenac is an anti-inflammatory medication. So it's hard to know if the improved results were due to the tea tree oil or were they due to the diclofenac that was also in the mix. So after reviewing the literature, what I've realized is that there really is a paucity of great information, great results when it comes to looking at these alternative potential medications for improving one's hair. It's all about, I think, when you choose which of these actives to use in different hair products, such as shampoos and conditioners and different serums for the hair, you want to choose ones that have some data behind them beyond, just some old mouse study or some very basic in vitro study that really wasn't too convincing. So after all this review, the 4 natural ingredients that I plan on hopefully introducing into some of the products that we will be eventually releasing and working on would be caffeine, for its potential to counteract stress-induced hair loss. Stress is something that's highly pervasive. We all are living under stressful conditions very often, so I think something that potentially can counteract that is a very useful type of ingredient to include. Also, curcumin, for its anti-androgenic and anti-inflammatory properties, shows a lot of promise. Also, pumpkin seed oil. It's been shown to be anti-androgenic, and I think that study was highly convincing, and that is something that I plan to add in as well. And then lastly, saw palmetto, which is a very commonly used active for hair growth, for overall hair health. It's anti-androgenic and anti-inflammatory in nature. So these are the ones that I plan on hopefully introducing into our products, and we'll see what else we choose, and we'll see what other research comes out in the literature on these complementary and alternative types of ingredients and medications. Now, these natural ingredients should not replace the more standard medical therapy as we've talked about on this channel. That includes things like minoxidil, finasteride, laser light therapy, PRP, microneedling. Those are all tried and true therapies that have worked for many, many, many people across many different studies. And these natural ingredients don't replace those medical therapies. It also doesn't, it's not meant to replace hair transplant surgery. But what it's meant to do is to provide you with something on a daily basis that can overall improve your hair health and hopefully be complementary to those other modalities that we've talked about on the channel.